So what about physical therapy around the time of knee replacement? So if we're going to do an outpatient ASC-based knee replacement for a patient, we will actually have them go to physical therapy before surgery because we want them to become an expert with their walker or their crutches and be really capable by the time they are in the recovery room and have to get up and walk to the bathroom before they can go home. We want them to feel like they're really an expert with that walker or crutches and have some exercises to start doing on their own at home when they get home. If a patient's in a hospital-based setting, then we actually do that physical therapy after surgery before they go home in that day or two when they're in the hospital. So we teach them all of those things, including how to do stairs in the hospital. And again, we teach them some exercises to start when they go home. Outpatient physical therapy is what we typically do with patients starting about 3 to 7 days after surgery, depending upon scheduling. And that involves learning walking again, range of motion of the knee, stretching, strengthening, general core strengthening, etc. And that's typically about twice a week for the first month, maybe once a week for the second month, and then maybe every other week for the third month, depending upon how a patient is doing. So if you're having a hard time getting your range of motion, you might go back more often to the therapist. If everything's going really well very quickly, then you might go less. It just depends upon how things are going. A lot of patients ask about home physical therapy. And we can do that if a patient is homebound and doesn't have access to transport, or it's very difficult to get transported to a therapist based upon where they live, their help at home, whether they have access to transportation, etc. We don't love home therapy if we can avoid it because we tend to get really variable quality of the therapy. Some therapists who are home therapists are fantastic, and some don't do quite as good a job, and we don't have any control over that. And that makes us frustrated when patients come back in at 2 or 3 weeks after surgery, and they really haven't done a whole lot of range of motion or stretching or walking, and we're kind of behind the 8 ball then trying to catch up. So if we can do it, we prefer an outpatient therapy location where the therapists have machines to have you work on, like exercise bikes and treadmills and weights and that sort of thing. But again, we can tailor that to how a patient's specific home situation and life situation is. Therapy is one of those things where it's really important to do it and to not just do it when you go to the therapist. I joke about the piano teacher effect, where you only practice piano when you go to see the piano teacher, and if you don't do your lessons during the rest of the week, you're not going to get very good at piano. So it's really important to commit to working on your therapy on your own at least once or twice a day, and that will help you when you go to the therapist do that much better and advance that much more quickly.